So type 1 diabetes usually is insulin dependent and begins in childhood, and it's also called as juvenile diabetes. And diabetes mellitus is a chronic life condition that affects your body ability to use your energy found in food. All types of diabetes have something in common. Normally, your body breaks down sugar and carbohydrates that you usually into special sugar called glucose. And glucose fuels the cell in the body that cells need insulin, a hormone, your bloodstream to take glucose and use it for energy. Gestational diabetes is something where a lady acquires diabetes during pregnancy in the third month or fourth month or any time in the 9 months. And after 9 months, once the baby is delivered, the lady is totally free of diabetes. And that is what is gestational diabetes about. And you have to be extremely careful because you can get into any complications. So you need to have a good diet control, you need to have medication, and you need to have sugar control as well. Sorry. A trick. The growth and the development of the baby also changes once the mother has diabetes. So she needs to take care of what she eats, she needs to take care of her weight, and otherwise they'll end up having a very huge baby, and the baby's weight is really like, and it is like big, but it may not be very, very healthy. So you need to be very careful with all your sugar levels once you're detected with diabetes during pregnancy. Adult onset diabetes. With the epidemic of obesity and overweight kids, more teenagers are now developing type 2 diabetes, or is also called as non-insulin dependent diabetes. It is milder than type 1, but still can cause major health complications, particularly in small blood vessels in the body that nourishes kidneys, eyes, and nerves. It increases the risk of heart disease and stroke. And with type 2 diabetes, the pancreas usually produces some insulin, but the amount produced is not enough for the body cells. For the needs of the body cells are resistant to it. Diabetes does not make enough, body does not make enough insulin. It can use the insulin it produces or a combination of both. Since the cell can't make glucose, it builds up in your sugar, and high level of blood sugar damage tiny vessels in the kidney, heart, eyes, or nervous system. It can eventually cause heart diseases, stroke, kidney diseases, blindness, nerve damage, moreover, in the nerves of the feet. Signs of trouble: high blood sugar or hyperglycemia, frequent urination, increased thirst, dry mouth, blurred vision, fatigue, and nausea. They do have sexual problems also, and they're likely to be depressed all the time. Their wound healing is extremely slow, and they could have tingling of arms and feet as well. They could experience sudden weight loss, and it could be a combination of 2 to 3 different things or many things in one, depending on how the sugar control of the person is. This is a pictorial representation of what I said. There is, you feel, some patient feel very, very, hungry all the time. Some patients have to keep on going to urination. There's constant urge, there is incontinence, there is loss of weight. You see wounds that won't heal. They experience blurry vision. They have sexual problems, impotency in men, dry vagina in women. Women are prone to vaginal infections. They are prone to having fungal infections, tingling, numbness of feet. and always thirsty for large quantities of water or small quantities of water, depending on the constitution of the patient. Get into the complication of diabetes. Medical risk associated diabetic retinopathy. Many of them stem from damage to tiny blood vessels in your eyes. There is a kind of rupture and blockage. Sometimes you see retinal issues and retinal detachment. There is diabetic neuropathy, tingling numbness of hands and feet, leading to very low sensation, moreover, on the feet, which gradually diminishes. And the person is prone to injuries on the foot, leading to non healing wounds, further on, leading to diabetic ulcers, further on to gangrene. Last month, I had a patient who was a principal of the school, and she's around 58 years old, very active. Diabetes is pretty much under control, but sometimes her sugar level fluctuates, and we saw a child just jump on her foot, and within a day's time she developed a gangrene, and it was so quick that you couldn't even imagine it was that fast. And one of her toe had to be amputated. That's when they just realized, let us get in touch with Dr.Rakhee Vakil, and then the other finger was also about to be cut, and the surgery was aligned, say, approximately a week later, because this wasn't healing so well. So, looking at the signs and symptoms, we had given her sickle core for gangrene, and we saved the lady from amputation of the second toe. More about neuropathy. Neuropathy is a serious complication of diabetes. Up to 70% of people with diabetes have neuropathy. Neuropathies can occur in any part of the body, including the eyes, heart, lungs, and feet. Peripheral neuropathy is most common type. Peripheral neuropathy occurs very slowly. Initially, it affects the foot, eventually spreads to the ankle and leg. Because the nerves have been damaged, patients don't feel pain. Patients may be unaware of foot injuries, which can lead to open sores, and these sores do not heal and they become infected. And as a result, they get into more complications and they are likely to get amputated. And if not taken care, the gangrene proceeds further and further. Neuropathy also results in muscle loss, and this makes standing or walking difficult. People with neuropathy may be depressed and socially isolated. Neuropathy also decreases quality of life. Diabetic nephropathy. Diabetic nephropathy is diabetes when it starts affecting the kidneys. This is what happens. Increased ketones in urine, which is called as diabetes ketoacidosis. So one must constantly keep a check on excess ketones in the urine and watch your appetite, for which you have to keep on doing your renal function tests on regular basis to assess that how your diabetes is controlled in your body, and it gives an indication that if you need to address your issues, then we can come to know through the abnormal renal function tests or ketone bodies in the urine that are present. More serious is the risk of heart disease and stroke. Hypoglycemia, also called as low blood sugar. If your blood sugar drops below target range, sweating, shakiness, blurry vision, weakness, hunger, dizziness, headache, palpitations, slurred speech, drowsiness, and confusion. Treatment: have a candy, juice, or any source of sugar. But the point is that symptoms of hypoglycemia and hypoglycemia are very close to each other. So one has to be very alert when you think that you're in a hypoglycemic stage before you pop in a sugar, because the similar conditions happen in hyperglycemia, that the person has a lot of sweat and there is shakiness, they may faint and they may have a blurred vision. So one needs to be very vigilant to understand that the patient is under hypoglycemia or is having hyperglycemia. Type 1 diabetes is insulin which needs to be injected through the skin into the fatty tissue, and usually methods by allopaths that are used are syringes and insulin pens. There is this HbA1c, which is called glycosylated hemoglobin, which is a specialized test which can be done once in 3 to 4 months, which gives an approximate idea of how the diabetes has been fluctuating in your body for a period of 3 months. So the normal being below 6 is absolutely good, and the diabetes is under control. Anything beyond 6 to 7, 8, 9, 10, beyond 10 is totally out of control. So one needs to get yourself assessed once in 3 months if you're a known case of diabetes, to understand whether your HbA1c is in control or not. Your HbA1c may reflect a total different picture than what your fasting blood sugar or your postprandial blood sugar indicates. Lifestyle changes. Frequent testing of blood sugar level, careful meal planning, daily exercises, taking insulin and other relevant medications as needed. Insulin resistance, however, it can be controlled by weight management, exercise, proper diet, nutrition, and good change in lifestyle. You have to do a periodic checking to see if there is any organ damage. However, diabetes can be controlled by weight management, exercise, proper diet, nutrition, and good change in lifestyle. You have to do periodic checking to see if there is any organ damage or not. Prevention is better than cure. Diabetes and youth. We see a lot of diabetes prevailing in young students and in teenagers and also in young adults between the age of 20 to 40, because of their weight, their sedentary lifestyle, lack of exercise, and the diet that they have, and the amount of stress they take. So these days, children are very, very prone to eating junk food, and they have no control over what they are eating, and they're in front of the screen all the time, which really gives them no exercise. So lifestyle change is definitely recommended. And when you see a young patient with diabetes, one has to guide the patient not only with medication, but overall overview of changing your lifestyle, your sleeping habits, your eating habits, your working habits, and all of it. And you can really prevent the person from getting into any kind of complications. Stress. These days, children have stress for giving exams, adults have stress with money, with work, with a bad boss. It could be just anything. Every person on this earth has stress, but it depends on how you take it and how it impacts you. And that's how homeopathy works, that each person having diabetes will receive a different set of medication depending on their signs and symptoms, their mental condition. And that's how we work on individual patients, and we treat them, help them overcome the burden of diabetes, and we can reduce their allopathic dose intake, and homeopathy can take over, and that then over a period of time we can slowly wean them off homeopathy as well. Stress, peer pressure, being unhappy, late nights, not getting enough sleep, irregular lifestyle, and depression, these are the things which absolutely are a perfect ground for the diabetes to fulminate. It really increases if all these factors are constantly a maintaining cause in your life. So you have to cut down on maintaining cause, whether you take any pathy, without which your diabetes control will be very prolonged. Treatment of diabetes and drugs. Healthy eating, fruits, vegetables, and whole grains, and monitoring carbohydrate intake. Eating good amount of vegetables will give good amount of fiber in your body and good amount of essential nutrients, which really help you control your blood sugars, and you really start feeling light and feeling good instead of feeling very very heavy with a bowl of rice or four chapatis for lunch, which usually Indian people are used to. And in countries abroad, they are more used to eating a lot of bread or rice, which needs to be monitored. It's not that you don't totally eat, but you eat certain meals in certain proportions with a good guidance of a doctor, which really helps in maintaining your blood sugar levels very well. Regular exercise. Choose what you enjoy. Make physical activity a part of your daily routine. It could be a Zumba dance class. It could be going for a swim. It could be a workout in the gym. It could be Pilates. It could be anything that relaxes you and keeps your body in good shape by giving good exercise to every part of your body. So it is very, very essential to exercise regularly. You could go for a plain, simple walk 5 times in a week, walk 10,000 steps, and that could also get a very good control over your diabetes. It's totally inexpensive and very easy. Anybody can do. Just simply walk morning, evening, and it really controls your diabetes very well. Yoga. Yoga is a very holistic approach. There are certain pranayams and certain yogic postures which help diabetes control because it really relaxes you, it calms you mentally, physically, emotionally, and meditation also along with yoga, which could be a part of your yoga, can also reverse your diabetes. We've seen patients fantastically doing very well with yoga, homeopathy, and a lifestyle change and a diet change, and their diabetes have completely reversed. Blood sugar level monitoring, which is very essential. You have to keep checking your sugar levels all the time. You cannot ignore any part of it. As you see, your wife left a few messages reminding you to check her blood sugar levels. So one has to be very, very agile. And if you do not maintain your blood sugar levels, you may be landing in soup if you're having diabetes. Diabetes tests. We have a fasting blood sugar, postprandial, which is to be taken 2 hours after your meal, and the HbA1c, which I just spoke to you about, that it gives an average of 3 months of diabetes. There is a oral glucose OGTT, oral glucose test, where you have a lot of glucose and then your blood is tested. Random plasma glucose test, and the normal values of fasting are 70 to 110 and postprandial is 110 to 140. One day I would love to say that I used to have diabetes mellitus. I don't want to be perfect in life, but I want a happy life. So it's most important to be happy and healthy, which is the key word of our seminar today, happy, healthy homeopathy. Remember to keep control of your life. Don't let diabetes control you. Now, we have some fantastic homeopathic medicines which give fantastic results, but one has to be very vigilant of what you're giving, when you're giving, to whom you're giving, and what are the symptoms. Individualization is the key to homeopathic treatment. I have set a list of certain medicines, but that doesn't mean that you randomly take or give anybody. One has to take proper case taking, and after which we have to assess the mental condition, physical state, and then assess which medicine is applicable. But these are some remedies which I have used in my practice with fantastic results. Uranium nitricum, it is like assimilation disorder and lots of sugar in urine. When somebody goes for a urine examination and you see 4 plus in urine, uranium nitricum has given very good results. Acid force. We see patients are totally worn out and absolutely, they have no energy, absolutely like the acid group. The debility is to next level. They perspire a lot. They urinate a lot. So that keeps them there drinking water and they're passing urine. They're drinking water, they're passing urine, they feel very exhausted. They want to lie down all the time, prostrated all the time, no excitement to do anything, with a lot of memory loss and all of it. Acid force gives very, very good results. It works very well in senior citizens also, and it brings a lot of energy level without any use of vitamins in their life. So they've been popping vitamins also, but still they do not get their energy levels back, where acid force has given fantastic results. Arsenic alb. This is one remedy which also has very good control over diabetes, where the patient has increased thirst for sips of cold water. The patients are usually very restless. If an arsenic patient comes to the clinic, they will never sit, or if they sit for 2 minutes, they're either their leg is moving or they'll get up and they'll move around in the clinic in your room, or they will keep on, they'll be very anxious. What's going to happen to me? Will I die? What's going to happen in my will my diabetes come under control very soon? What is how much expense is going to be there in the diabetes treatment of yours? So since it's a fourth row remedy, they are very concerned about money matters, and that's how you consolidate and you give arsenic alb. Works wonderfully well. Sulfur is used as an intercurrent, very good with skin complaints. I recently had one patient of diabetes, and she had a very, very red anus with piles. She had ulcers in her mouth. Her diabetes was not under control, and just a few doses of sulfur, within 3 days, her redness of anus has completely gone. Her ulcers of the mouth have reduced. She was putting steroid creams. She was putting coconut oil before she came to me. She was taking cold water, sibs bath, everything, without which it was just not helping her. It was so difficult to pass urine, so difficult to pass stool. She was not able to sit, she was not able to walk. It was really very difficult. So, a few doses of sulfur has just given her fantastic results. Also, we get fungal infections with diabetes, nail infections, where if sulfur is indicated, sulfur is usually a hot patient, they are ill tempered, and they think no end of themselves. They think that they're the kings. So it's like a ragged philosopher is what a sulfur is called. So you match mental symptoms, and this is one case I just solved last week with sulfur. Phosphorus is usually given with eye complaints where they see blurry vision, and if the symptoms match, phosphorus is also a fantastic indication. It's usually given in lean, fair, thin, and tall people with light eyes, and they are very friendly. They are very sweet. They're amiable. They love to make friends. They are very sweet when they come to the clinic when they talk to you. So that's what demarcates phosphorus. Natrum sulph. Patients having diabetes have a lot of digestive disorders, liver dysfunction. So if you take natron sulph in lower potencies, in biochemic form as well, or 3200, depending on the level where the patient is. We've just discussed levels with Dr. Meeta, that first, second, third level. That way you just prescribe natron sulph for digestive disorders. It really improves liver function very beautifully. Gymnema sylvester. It is also a very good remedy used in mother tinctures, most probably for profuse urination loaded with sugar. Urine is passed in large quantities. So you usually, there are patients who have prostate problems and diabetes. This gymnema is one drug which really works very well. Sisgym jambolum. It's the seed of the jamon tree, and it's the if you use it in the mother tincture, it really reduces blood sugars magically. But again, you cannot use it therapeutically and randomly on any patient. The symptoms have to be matched. Abroma augusta. You see a lot of albuminuria in diabetes with debility. The patient will complain and say, I am passing white urine, or I'm passing some long strands in urine. And you feel very debilitated, Augusta gives very good results. Insulin is also used in lower potencies, but insulin cannot be used like how you use allopathic insulin. There are certain indications which need to be followed, and you give very, very good results. So this is about homeopathy and diabetes, and there are a lot more drugs which are yet indicated. These are a few and very highlighted drugs which I have shown. We've seen giving very good results, like you give calcarea carb and in a constitutional obese patient. Very close coming is pulsatilla also, would be mild yielding disposition, and that's how you demarcate with constitutional. So apart from these, if constitutional has to be given, say once in a month or twice in a month, you have to give constitutional, and you may need more remedies to treat diabetes. Only constitutional may not help, because a diabetes patient comes with an array of symptoms, and whatever is indicated, you must give that patient at that point of time, and clean the patient with layers. Certain nosodes can be given in between to clear layers to reach there and to reach the best healing possible in a diabetes patient. So homeopathy is giving wonderful results, and we really encourage people to take homeopathy in whatever state of diabetes they come to us. So if it's a primary level just diagnosed, fantastic, you don't need any allopathic treatment, you can completely be cured with homeopathy. If you're in between, you're taking certain doses of allopathic medication, then also if you take homeopathy, it will give very good results. And slowly, slowly, if you can reduce the dose of your metformin. So if you're taking 1000 milligrams, you can, over a period of 5 to 6 months, you can come down to 500 milligrams, and so on. And then with the lifestyle and um, diabetic diet and all of those little changes which we have recommended, you can completely reverse your diabetes. So thank you for a patient listening, and I hope it benefits more people. And anytime you have any issue, please feel free to write to us, and please take care of comorbidities, because in pandemic, people have really, gone through a lot of trouble having diabetes and hypertension, and they have got into complications without any reason. So be prepared, be healthy, be happy,